Hey everyone, this revision video is going to be all about depression, everything you need to know for the psychology GCSE depression section. Quite a lot to get through and could be a bit of a long video, so I'm going to try and cut out lots of the noise. I'm going to go straight through the key information of what you need to know. What you need to know includes the following things. You need to know the characteristics of depression. That includes the different types of depression. You need to know the biological explanation of depression, where does depression come from, and you need to know a biological treatment for depression. You need to be able to evaluate both of those. You also need to know the psychological explanation for depression, the psychological treatment for depression, and again you need to be able to evaluate both of those. So let's not waste any time, let's go straight through it as fast as we can. So first thing, you need to know two different types of depression and how that is different to just a general emotion of sadness. So I'll give you the definitions. Unipolar's got the word uni in it, which means one. So unipolar depression is, probably the most common type of depression, but not the one that you hear about the most. Unipolar, one, so it's one mood. So it's a mood disorder that causes a person to feel constantly down, constantly sad, a constant low mood, loss of interest and enjoyment, and low energy levels. It's always down. Now, the one that you hear about the most in the media is the bipolar depression. Normally when I ask people what types of depression they know, this is the one that they say. And bipolar's got the word bi in it, which means two, and therefore it means two types of emotion. So it's the mood disorder that causes a person's mood and activity levels to sort of change from one extreme to the other. So it will be really low, typical depression, and then all of a sudden there will be this incredible high of energy and really positivity, and it's really difficult to explain why. Now, these two types of depression are completely different to sadness. Sadness is just your general emotional normal response that everyone will feel probably most days of their life. It's just a sort of a normal emotional response to something that's either sad, unpleasant, unhappy, painful. And like I say, it's something that you probably feel most days when something doesn't quite go your way. So people who have a sad moment aren't depressed, even though they would often say, oh, I'm feeling really down and depressed. But that's not a mental health problem if you're just having a negative reaction to something. For the exam, you need to be able to comment on some key characteristics of unipolar depression specifically. There are 10. The top 3 are the main 3, but there are 10 that you can choose from. And they are having a low mood, showing loss of interest and pleasure in things that you would normally be interested in. So if you really like football and you suddenly stop playing football, that could be a key sign. Reduced energy levels, changes in your sleep patterns, so that could be sleeping more, sleeping less, sleeping at different times of the day, struggling to get to sleep. Changes in your appetite levels, again, that could be eating more or eating less. A decrease in self-confidence, reduced concentration, feelings of guilt, negative thoughts about the future, and self-harm or suicidal thoughts. So these are the key characteristics. In the exam, you probably need 3, but there's 10 that you can choose from there. Now, you need to be able to explain where depression comes from, and whilst this is very much still debated in the world of psychology, there are 2 main explanations that you need to know for the exam, for the GCSE, and the first one is the biological explanation. And the basic idea of it is that there is a neurotransmitter imbalance going on in the brain. Specifically, a person with depression, the biological explanation would say, has a lack of serotonin. And that serotonin, that neurotransmitter, is found within the synapses within the brain. And in a previous lesson in topic 7, neuropsychology and the brain, we would have talked all about how neurons chemically pass a message from one neuron to the next neuron. So I'm not going to go into that right now. That's a different video for a different day. But essentially, within that synapse, when the neurotransmitters diffuse out of the vesicles into the synaptic cleft and go over to the receptors, people who have a low number of serotonin or a lack of serotonin, it has been found that these people may be more likely to have depression. So like it says at the bottom there, people with low amounts of serotonin in their synapses experience low moods more often, as the receptors in the next neuron are not getting stimulated enough. So this is the basic idea of the biological explanation. Now, if you had to evaluate in the exam whether or not this is a good theory or not about why people become depressed, these are some of the ideas that you can talk about. Firstly, brain scans. We scan the brain of depressed people and healthy people, and we do indeed find that a lot of depressed patients do have low serotonin counts. So this is good supporting evidence for the argument, isn't it? However, most of these ideas are a correlation, and you should know that the key problems with correlations is that we can't really determine the correlation or cause. Does having a lack of serotonin cause you to have depression, or is it the depression that's creating a lack of serotonin problem, something that we can't really easily determine just from a correlation? Next negative on the evaluation is, if you've got a serotonin problem, surely if I just give you more serotonin, it should fix everything. But it doesn't always work. We'll look at sort of antidepressants in a moment, and we'll see that they have a large success rate, about 60%, I believe, but it's not 100%, so it doesn't work for everyone. So for a lot of people, something else must be causing the depression as well. Now, good vocabulary, holistic and reductionist is really good words to use here. Is this treatment reductionist or holistic? Reductionist. It's focusing on just one cause of depression, which is a lack of neurotransmitters, and clearly there are many more explanations and causes of depression than just a lack of serotonin. And finally, some depressed people actually have normal serotonin levels. Well, if you've got normal serotonin levels and you're still depressed, clearly something else is causing your depression. So it's not a it's not a bulletproof theory as to why people become depressed. Now, following on from the biological explanation, you've got your biological treatment for depression. The fancy name for this treatment is selective serotonin reuptake inhibitors, SSRI for short, or simply put, antidepressants. In the exam, you can even write drugs, because that is essentially what they are. Now, what SSRIs, antidepressants, do is they sort of enter into the synapse and they block the reuptake of that serotonin. So again, as you should know from a previous lesson, once the serotonin is out in the synaptic cleft and it is being attracted to the receptors of the next neuron, once it's finished, it goes through the reuptake process, which means it heads back to where it started. It goes back to the vesicles. Now, what the antidepressants do is it stops the serotonin from going back. If we stop the if we stop the serotonin molecules from returning into the vesicles, they essentially sit in the synaptic cleft for longer. If they sit in the synaptic cleft for longer, they will keep getting attracted to the receptors, which means they will stimulate it for longer, which should hopefully increase our mood of a depressed patient. Now, is it a good treatment? Antidepressants, drugs, SSRIs? Well, firstly, they have side effects. Clearly not a very good thing about taking antidepressants. Side effects can be nausea, dizziness, insomnia, weight loss, weight gain, anxiety increase, and all things like that. So, you have to weigh up whether or not the side effects are worth it. On the positive, for society, they're incredibly cheap. Very, very cheap to make medicine like this. So it was a doctor's first choice for sure. As with all drugs, a negative is that people can become addicted, and they can risk an overdose, which is obviously not good at all. So big risk of taking medication and drugs. There's a lot of research out there that suggests the drugs don't actually work for antidepressants. Like I said a minute ago, about 65% success rate. And people who take a placebo pill, which is essentially a fake pill, often improve their depression as well, which kind of hints that depression might be a psychological problem if a fake pill is going to make you better. So it doesn't work for everyone, basically. And again, it's a very reductionist approach, isn't it? It's putting all of the assumptions that depression comes from a lack of serotonin, which isn't always the case. So biological explanation and treatments done. Let's move on to the psychological explanation of depression. Now, to explain this one, I've gone for a different angle. I'm just going to show you a model answer to identify and explain the psychological explanation for depression, and I'll explain it as we go through. So, if biology says it's something going wrong with your neurotransmitters, the difference in psychological explanations is that they argue that depression is learned through our nurture, and they argue that people who are depressed have negative self-schemas of themselves through bad experiences, which essentially means that they don't think they're capable of certain things. So what tends to happen is people will have a bad experience. Maybe they've tried to, I don't know, let's take a random example. Maybe they went into an exam when they were quite young, they had quite a bad experience, and the impact that had on them is it created a negative self-schema of themselves. So they didn't do so well. A few people said, well, you're not very good at exams, are you? And then this created the idea in their mind that they can't do exams. So the schema of themselves is now very negative, and they think, oh, I can't do exams. So this negative self-schema about themselves essentially has been learned through that bad experience. Now, if they have negative self-schemas, they're going to sort of, create a low mood and negative feelings around anything to do with exams. So this is just one example. There can be far more traumatic examples. So, this negative self-schema of things, of themselves, creates this low mood, this low self-esteem, this negative feelings about themselves, which is all symptoms of depression. What the person then also does is they will go ahead and attribute their own behaviour negatively. So anytime that they do something, they will blame themselves. So getting a low score in the next exam won't be because they didn't revise well. They will blame it on the fact that they are rubbish at exams. So a person with depression will negatively attribute that. I did rubbish in the exams because I'm not very clever. I'm rubbish at exams. Whereas a healthy person is more likely to say something like, I didn't do too well in that exam because I didn't really revise. I left it quite late. I tried to cram it all in the night before. I need to try a bit harder the next time. So it shows a complete difference in how people process their experiences, and a person with depression who has learned it will really blame themselves and because of that really negative self-schema that they've got through bad experiences. Now on this slide I've also got an example of how to evaluate the psychological explanation, but I'm not really going to talk about that. You can pause it and you can look at that model example. I'm going to talk about the evaluations in my bullet points on the next page. So in terms of evaluating the psychological explanation, we've got 4 ideas here. And let's go through them and figure out if they're good or bad, positive or negative. So the theory suggests that people think in the wrong way. From this, we have created a treatment called cognitive behavior therapy that helps people think in a positive way, and it works. Well, I mean, the fact that it works, clearly it's going to be a positive evaluation, isn't it? So from this theory, we've got a really successful treatment for depression. This is great. We can help people feel a lot better. Research evidence shows that depressed people blame themselves. They've got negative self-schemas for bad things, whereas others blame other things. Well, that's what the entire theory is about. So there is research evidence to support the psychological explanation of depression. So that's a good thing. There is research that shows animals and people give up when they learn that they cannot fix a problem. And you might remember the example that I gave you, the dogs and the electric shock study in class. Clearly another positive here is the fact that people learn to give up. They learn that they can't sort something out, so they learn their depression, they learn their low mood. And finally, there is evidence that a lower level of serotonin causes depression. Well, this is the biological viewpoint, and if it's biological, it's the opposite. So therefore, this is some evidence against the psychological explanation of depression. So you've got some evaluations there. You can use those, pause the video and shorten them down and make some notes on that if you want to for your revision. Okay, so the last thing you need to be aware of is the psychological treatment for depression, which is cognitive behavior therapy, a talking therapy that helps you manage your problems and emotions by sort of changing the way you think and the way that you behave. Now, for this, you need to know essentially how CBT works. You need to know if it's any good, and a quick piece of research into this as well. So again, let's go as fast as we can because this is already turning into a bit of a long video. So in the green box here, we've got a little bit of basic knowledge about CBT and how it works. So CBT says that our thoughts, emotions and behaviors are all linked. So, when it comes to depression, we're largely talking about having a low mood, which is a really bad emotion. So, it's really difficult to change your emotion. But if those three things are all linked, then what we can do is we can target your thoughts and your behaviors a lot easier. So what CBT does is it trains people to have some certain skills that might change their thoughts and behaviors into a more positive way of thinking and a more positive way of behaving, and therefore it should hopefully improve and increase their emotions. So just as a quick example, CBT might look at a person's behaviors and they might have a patient who has stopped doing certain things, and the therapist might say, "Oh, I've noticed you've stopped going to table tennis club every week. What's that all about?" And what the patient will be told is they will be given some homework. Homework is a key part of CBT, and that homework will be to do some positive behaviors. For example, go to table tennis club, go back to the club that you really enjoyed. And that positive behavior will hopefully have a knock-on effect onto emotions, which will increase emotions, make them feel better. Same with thoughts. The patient might have some negative thoughts like, I don't go to table tennis club anymore because I've not got any friends there. And the therapist might say, well, hold on a minute, let's have a look at your text messages. You've got 3 texts from people saying, why weren't you at the club last night? So clearly that shows that people do like you and they do miss you, and that's going to change our thoughts, and the patient will go, oh yeah, I suppose they do. And hopefully that will have a positive impact on our emotions. So that's how CBT works. Is it any good? Well, again, let's look at some evaluations and decide if they're positive or negative. The treatment lasts for a long time as it provides patients with the tools to treat themselves for a very long time. It lasts for a long time, guys. Clearly that's a very good thing, isn't it? And if they finish the treatment and they feel depressed later on in life, they've got the tools, they can treat themselves again, they can change their own behavior, change their own thoughts. Brilliant, amazing process. It's a very long, slow and expensive process. That means lots of people drop out of it and never get better. I think that's quite an easy one. That's negative. Not really much to say about that one, is there? Third one, it is a holistic approach. It tries to treat the whole person, the whole problem, by looking at more than just one source of the problem. So we're looking at our thoughts and our behaviours here, lots and lots of things. If something is holistic, we know that that is a really good thing. And finally, there is evidence that cognitive behaviour therapy is more effective than just drugs. And that's from some research by Wiles, which we're about to look at. So clearly, good treatment process here if it's got research evidence to back it up. Right, the final thing that you need to look at then is that research by Wiles 2013 to see how effective CBT was. What exactly did they get up to? Well, they wanted to see if CBT was any good at treating depression. So what they did, they gathered 469 participants from all over the UK. It's a very good thing, very representative, who had depression that was very resistant to treatment. And they assigned them to one of two groups. Half of them were given just antidepressants, and the other half were given antidepressants and CBT. After 12 months, 46% of those having the CBT and antidepressants showed massive improvements compared to just 22% of the control group. So clearly having that CBT as well more than doubled the effectiveness of the treatments of the depression. So in conclusion, when we combine CBT with antidepressants, we have a pretty effective way of reducing the symptoms of depression. Finally, we need to go through the evaluations here of that study to see if it's any good, and prepare you for your GCSE exam if you get asked to outline and evaluate the Wiles study. So firstly, it's a longitudinal study. You should all know that longitudinal studies mean that people drop out, and people dropping out of things is always bad. They don't complete the research, they don't complete the treatment. We don't know, therefore, if the treatment was working or not. Secondly, it's hard to control the other factors in their lives. Sure, we're doing CBT on them, but we don't know what's going on in their job, in their relationships. So we've got lots of extraneous variables here. You know that extraneous variables are bad. Definitely. Thirdly, a really high sample size to start with, all over the UK, highly representative, highly generalisable, all positive words, really good sort of planning from Wiles there. And finally, the study identified a new useful therapy for depression. You know, why just use CBT or antidepressants? Let's combine the two. It seems to have double the effect, so it's really useful. Right guys, that's it. It's a long one, but I say I've got all of depression summarised in this one video. You can watch it. Hopefully you've managed to get through it, or you've watched it in parts or something. That's absolutely fine. So quick recap, what have we covered in this video? We've gone through the characteristics of depression, including the different types of depression. We've gone through the biological explanations and treatments for depression, and the psychological explanations and treatments for depression, and that includes the evaluations along the way as well. So well done for sticking it through. It's a long one, but all in one place. Hopefully that's been useful to you. Right guys, I'll see you in the next one.